are working very hard to come up with some very tough solutions. It wasn't until recently that we received in-depth financials and calculations. I think recently was your budget meeting last Wednesday. And we're looking at those to analyze Jackson's financial situation, the budget, and the cost of the concessions that you've put on the table. We're committed to having data-driven, evidence-based discussions on how we can work together to balance Jackson's budget. The nurses, doctors, and other healthcare professionals, and many who showed up tonight, are certainly interested and have proven to you their commitment to help save Jackson over and over. Last year, we not only gave the $106 million, if you've heard so many of the employees refer to, taken from our families' budgets. We continue to work at the highest levels for our patients, continuing with the great health care and earning the distinction of #1 in South Florida. There are some who call our hardworking caregivers self-serving for fighting to keep Jackson public so that services to our patients won't be cut and or sold off to the highest bidder. But they should watch our feet. We've given from our own pockets. We've been working on efficiencies, as you heard earlier, and we are running a campaign to call to the public's attention the need to save Jackson and keep it public. Anyone who has spent more than a few days studying Jackson's operations will validate the rampant mismanagement that has accumulated over the years. From bad vendor contracts, to bad real estate deals, to broken bill collecting systems, to gross inefficiencies that have put Jackson in the crisis we're in. The caregivers are not to blame for the financial crisis, yet we are the ones that have been called on time and again to pay for it. Dr. Roldan assured us our $106 million would right the ship. It didn't, because the incompetence at the helm continued. Our families cannot afford to flush any more money of our hard-earned dollars away on bad decisions. We are grateful to have a new CEO that appears to be tracking in a different course. Mr. Magoya, we appreciate your hard work and your dedication and your access and your frankness. We appreciate that. But your caregivers need to know that our sacrifices will count this time and that we want to be proven in 4 ways. We want a plan. We want to have a real strategic plan to save Jackson. As far as the sacrifice, we are asking the employees for a realistic sacrifice. Are your takeaways overreaching? Are your takeaways overreaching, or are they takeaways sensitive to market pressures? Are there equitable cuts to all stakeholders? And finally, the most important, the patient care. Will our patients be protected? We need guarantees of no decreases in services. We're doing our due diligence on these 4 questions. We hope they are answered and that we can continue to work together to save Jackson. Obviously, the short-sighted cuts will lead to long-term problems and will not work. We've seen those already. We need to know that strategic fixes are being implemented. There is no doubt in my mind that Jackson can be saved, and we will continue to work with you as a partner on that front. We need this hospital to remain a thriving public jewel. I assure you that the employees will help, as long as we know the help we are giving will provide a fair solution to the employees and the community. Thank you.
Thank you, Martha.